Cervical cancer is preventable, right?
Yeah, almost every case is preventable. Traditionally, that's meant screening tests, and we think of the PAP, right, with that. Although now there's also a test for the human papillomavirus, HPV, which is the virus that causes virtually every case of cervical cancer globally. So screening might involve a PAP or actually a test to find the underlying virus. And also, of course, vaccines are critical. We have a great vaccine on the market that is able to block pretty effectively infection with the types of HPV that are found with about 90% of cervical cancers globally.
You talked about the screening. I understand there's a new option to screen for cervical cancer. What can you tell us about self-collected samples?
So that's very exciting. So with self-collection, a patient is given a kit. It has a test tube and there's a brush or a swab in it. They insert the brush into the vagina, not unlike inserting a tampon, and it's swirled or rotated for like 5 turns or 20 seconds or so, whatever the exact instructions are. And then it goes right back into the test tube, and then that is sent off and is checked for HPV, for the human papillomavirus. The test is not approved for at-home use at this point, so it has to be done in a clinical setting, like a provider's office. But one of the advantages is that it doesn't require a pelvic exam. So for a lot of patients, this might be a more private, comfortable option. The other advantage is that since it doesn't require the pelvic exam, it can be done potentially in clinic settings where they don't normally do cervical cancer screening. So like in a primary provider's office, or even some non-traditional venues, like maybe eventually pharmacies.
Tell us about the HPV vaccine. Who should get it when?
CDC, the Centers for Disease Control and Prevention, they recommend it for everybody routinely through age 26 with a focus on vaccinating at ages 11 and 12. It can actually be given as early as age 9. And for someone up through their 14th birthday, they can have a 2-dose series. Past 15 and older, it would be a 3-dose series. The reason that they like to give it earlier is because the younger it's administered, you get a more robust immune response. So you tend to see better protection in place. And the idea also is to get the vaccine to young people before they become sexually active so that when they do, as they get older, they have the protection already there. And it's not just cervical cancer. The vaccine is approved to prevent a host of HPV-related cancers, including some of the head and neck. The most recent data I've seen said that for looking at kids in the US between 13 and 17, about 3/4 of them have had at least one shot of the HPV vaccine. Roughly 60% are up to date, so they've completed their vaccine series. So, that's trending in the right direction, but there's obviously a lot of work to do there. We really, really want people to talk with their healthcare provider about how often they should be screened, what their approaches they recommend, whether it's a PAP test alone, an HPV test alone, or a PAP HPV co-test. We're not so hung up on that. We just want people to get screened and to have these conversations with their provider to see, given their medical history and their age, what is recommended, and just go do it. And that's the key.
Well, Fred Wyand with the National Cervical Cancer Coalition, thank you so much for speaking with me.
It's my pleasure. Thanks for having me on today.